All acne starts with a blocked pore, so something that we call a comedone, and then that acne can grow and become an inflammatory bump or a pustule. Sometimes acne can get really deep and form cysts that are very painful in the skin. So it all starts kind of with the skin at the surface of a pore being sticky and oil building up underneath. People are always worried about hygiene, and they come into me and they're saying, I'm washing my face, and acne is not from not being clean or not washing your face. There's two main things that contribute to acne. One is hormones, which affects the oil production in the skin, and then the second is the stickiness at the top of a pore. So when that skin sticks, the oil builds up beneath the surface of that pore. And everyone has some bacteria in their skin. When there's increased oil, the bacteria eats more and multiplies, and then the body responds to that bacteria by sending in immune cells, so then it becomes red and inflamed and painful. There's very little evidence in the research when they've looked at foods for them contributing to acne. The main research has just shown that skim milk can contribute some to acne, as well as high glycemic index foods. So those are high sugar foods that spike your blood sugar. But foods really have a minor role in acne. There's some other things that people can do in their lives that can contribute. So wearing certain makeups or oils or lotions on the face can block those pores. So you need to select a makeup that says non-comedogenic or a sunscreen that says non-comedogenic. And also sometimes people who always wear like a headband or a hat, that rubbing can kind of occlude those pores. So those are the main sort of lifestyle things that contribute to acne. Sometimes patients come to see me when they're young for other things, and if they're just starting to show a little bit of acne, I give advice on some over-the-counter like salicylic acid washes. But when it comes to deciding the treatment for acne, it depends on what sort of acne I'm seeing on the patient's skin. All acne starts with the stickiness at the top of the pore. Really the best treatment for everyone is to have a topical retinoid. And then I pick different treatments depending on what I'm seeing, and we can pick different strengths of those medications, but we can target the bacteria with a topical or an oral antibiotic. We can target the hormonal influences with birth control or a medication called spironolactone, which blocks male hormones in the skin. And if patients are developing scarring or not responding to treatment, then we sometimes use a medication called isotretinoin, or people might know it was called Accutane in the past, and that kind of shuts down those oil glands. So I kind of target my treatment based on what I'm seeing on the patient and how they've responded to treatments. So Accutane, when used correctly by a physician who knows what they're doing and is familiar with the medication, is very safe. There's certain things we watch for, and most people get dry skin and dry lips with it, but the majority of patients tolerate it really, really well. And for most patients, it just shuts down their acne and they're able to have clear skin without any additional treatment long term. A lot of people have acne during their teenage years, and for most people it resolves, but especially for a fair number of women that can continue into their 20s, 30s, and 40s, and sometimes adult women develop acne when they didn't even have much acne as teen. And it's mostly in women related to hormones, since with menstrual cycles, hormones are fluctuating. So we have certain treatments we can use to kind of target the hormonal effects of acne. Teen acne and adult female acne sort of have different presentations. In women, it's a lot more common to get acne along the jawline and the chin, while in teenagers tend to either have sort of T-zone, which is forehead and nose, or whole face, chest and back I see pretty commonly, so the patterns can be different.